Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes for the last 20 years and Chief Medical Officer of Good Samaritan Physician Network. Joined with Adam Thacker this morning, who is our Chief Operating Officer of Good Samaritan Hospital. Today we'll be giving you an update on status of COVID in our community, kind of an outlook as to some recent data that's come through with the Fairbanks study. Also be looking at kind of statewide trends and nationwide trends as to what's been happening. And then also a review of kind of where we're at as far as local precautions are concerned. So starting off, Adam, this morning we're right now at about 44 cases that have been tested positive. We've done almost 1,600 tests. So one of the big things that has changed is we're testing a lot more people. And so the numbers of those that are being tested has gone up. So we're catching more cases as well. And we're seeing a little bit of a steady rise in the number of cases over the course of the past few weeks or so. Could you talk a little bit about kind of where we're at with that and where we're going from here?
Yeah, and a key point of that is the number of tests that are being performed. So if you're performing a lot of tests and looking for a presence of illness, you're going to find it, as opposed to maybe normal pre-COVID. You didn't look for it unless there was a symptomatic need or even potential hospitalization. But with widespread testing, we are identifying those cases. So a pretty big increase in cases since Memorial Day, almost double the number of cases. Key point to take away with that is we have only had one hospitalization during that time, and so the vast majority of individuals that have tested positive, either asymptomatic or mild symptoms, are recovering at home. Many of them have already recovered. I think when you look at those 44 cases that we've talked about, there's somewhere in the 10 to 12 range that still have active illness and are recovering at home but are still considered active in quarantine. So really what that means is, I think as Dr. Stine and I were speaking, we expect to see a case, 1 to 2 cases even a day as this kind of moves forward, as things open up, but really focusing on that hospitalization rate and that folks are able to recover at home and then develop antibodies and hopefully some immunity, or making that less likely that if there was a reinfection that they would have a as severe of an outcome. So that's really important as we look at that. Puts a lot of emphasis in the community on when you're going to large gatherings. So we've got church services, we have our youth sports reopening, we have other activities, activity centers, that type of thing, family gatherings, social distancing, masking, hand hygiene. We've said it for weeks and weeks and weeks. Really becomes important that we are looking at that. On a national landscape, we have seen a lot of comments this weekend about Florida. And Florida really saw a spike in cases. So if traveling, this is a vacation time of year for families and for folks to get away, especially after we've been on a lockdown. Now it's time to travel. So it's not restricted. There's no executive order from the governor or law that you can't travel, but you need to be smart about how to do that. And same if you have family visiting from Florida as an area that's been just identified as a watch area, just being smart about the hand hygiene, the gathering. Anybody having symptoms should refrain from those gatherings and let your loved ones or friends know that you're not feeling well. And I think everybody's pretty respectful and mindful and appreciative of that information.
And that takes us kind of back to when we started this. It was really important, and we were asking a lot of questions about, have you traveled recently? Have you had contacts with anybody with symptoms? And then we went into a phase after that was we really didn't care, because we assumed that everybody had had exposure and everybody had been to a region where they had positive cases. And so we didn't ask and we weren't as concerned, but now we're sort of getting back to that again.
Right.
And I've had a lot of questions over the course of the past week or two, specifically as to what Adam was addressing, which is, what about travel? We have family plans, we want to go here, we want to go there. And it's important to keep in mind that that's what the entire nation is doing right now. It's not just us. We haven't all just been feeling that here locally, but everybody is, and everybody wants to get out. And so the landscape here locally, especially like in District 10, if you look at that within our state, we have very low numbers within our district, especially when you compare that to the Chicagoland region and the Indianapolis region. Really, the majority of the rest of the state is very low in population. However, when you pick yourself up and you move yourself to another location, specifically a population center, all of that changes. And so I think we have discussed in previous weeks the issue of we know that as people get out that there's going to be increased number of cases. We know there's going to be increased spread and transmission. And so that's why continuing with all of those things that you emphasize is very important. And then obviously also being cognizant when you return from your travels about symptomatology. One of the things that we've talked about in the past also has been the relatively asymptomatic population being about 43 to 45% of the population has absolutely no symptoms. And so the challenge of that, of course, is that you potentially may have the virus and can be spreading that and not know about it. So that's why when people ask, why are we doing this masking? Why are we continuing to do all this when every report shows that in general numbers are decreasing and flattening out and things are getting better? It's simply because of that we know that just as we discussed a few weeks back that post-holiday, post-Memorial Day, we expected to see a rise, and we have seen that rise, but it certainly has not been the flood that we were concerned about back when we started this essentially in March.
Right. And considering the rise in cases, I still look at Knox County and our region as very successful in how we're approaching coronavirus, because that population that's at risk with a lowered immune system due to some type of chronic illness, respiratory, lung disease, diabetes, heart disease that we've talked about, or an older population, those are the folks that really have to be diligent about the social distancing, the masking, the staying at home versus getting out, which I know is difficult. And as family, loved ones, friends of that population, we also have to be aware of that. And I think that's where we've had a lot of success, is that even though we're seeing an increase in transmission of cases, that low hospitalization, I'm still very happy to report, I'm knocking on wood, that we have 0 Knox County deaths. We want to keep that number as long as possible. And that's really due to all of the activity that are around, those safety precautions.
Yeah, and lots of things have changed in terms of nursing homes have started opening up their visitation. We have opened up our visitation, and we feel that all that is extremely important as far as the care of our patients, but it's important to recognize that as that happens, we all still need to be very vigilant about hand hygiene and our masking strategies and so forth. And just like you said earlier, even when we have family gatherings and things like that, I've had a lot of people ask about, well, can we go over and do birthday this or party that? And the more outdoor, the more open, the more separation that you can have during those events, the better. Because that population that you were alluding to is still at risk. And so even though we're seeing an increase in the number of cases, the majority of those cases have been in relatively healthy people that recover at home, and so it doesn't have as much of an impact. So as we're seeing patients in the offices and catching up on health maintenance and disease management, it's important that those patients that have kind of sequestered and kept themselves at home realize that as you come back out, it's still important to make sure that you're doing all those measures.
And to that point, with the community transmission, healthcare is still a very necessary imperative. So this is not the time to put off preventative medicine or your doctor's appointments. The safety precautions that we have in place at Good Samaritan make this one of the safest places in the region that you could come to. And continuing with your health care is very important, whether that's through a virtual avenue or whether that's a face-to-face. Your physician's office can work with you on what the most appropriate route is, but certainly don't want anyone taking away the message of, okay, I need to cancel my appointment and push it off. We want to maintain an ongoing relationship with you and your healthcare needs.
And we certainly anticipate that as we march through the next several months or so, that we will continue to see cases as we have been. And there may be a bit of a rise, a bit of a decline. It's important to realize that we're not going to just extinguish this and it's going to go away. But we hope that what we're seeing as far as the number of really sick individuals, the number of hospitalized individuals, and the number of deaths, as that continues to decline, that we hope that that virus is becoming less virulent. And we know from previous studies with other similar type viral illnesses that that's basically the natural evolution of things, is that the virus stays around, however it becomes less and less and less virulent, causing less severe complications as a result of infection. So we've talked a little bit about this sort of being the sweet spot to re-engage in your health care, because we know that as cold and flu season comes around in the fall, everybody is going to be assuming that they have coronavirus at that time. And so as far as getting in, doing your wellness, getting your chronic diseases managed, this is the best time to be doing that.
Right.
One of the other things that we had spoken about that we've been eagerly anticipating is that phase 2 of the Fairbanks study. And I think we saw some very exciting things with the first round, some kind of curious things with the first round, meaning that 43 to 44% asymptomatic rate, and that was replicated again. That again, they saw that there was a large percentage of the people that tested positive that never had symptoms at all. But probably the biggest thing that came out of the study this time was the number of active infections was down by like a third or so.
Right.
I think it was 1.7 down to 0.6, so decreased dramatically. And then there was a significant increase in the antibodies that were positive as well.
Yeah, which is good news, right? So we're looking at active infection going down on a statewide number and antibody presence going up, meaning that kind of as we've talked about here in our community, that folks have come in contact with SARS-CoV-2, have recovered and developed antibodies, and there's still that looming question of what does that mean. But it can only mean something good. Either that recovery from a reinfection is going to be easier and have a better response, or that you do have actual immunity, and that remains to be seen. But yeah, phase 2 looked a lot like phase 1, which was good in information, except for the active infections down. Antibody presence was up a little bit. Phase 3 is going to happen this fall, which is again around that 5,000 Hoosiers. So this is where we put in a little bit of a plug. If you get contacted by the state to participate in the IU Fairbanks School of Health study, please do so. Phase 2, we hosted the site that Fairbanks came on site at Good Samaritan to do the testing. So if you get that information, we'll likely participate in that again in phase 3 and host a site.
And mentioning testing, I've had a lot of people inquiring over the past several weeks about antibody testing. We've been now offering that here for about a week and a half or so, and my personal experience has been all the people that have requested for me to order antibody testing, all negative. And so kind of an ongoing theme that we've had over the past several weeks or so is that I know that I've had it. I know that I had the infection. I was probably case number 1, and in fact there are lots of viruses that cause similar type symptoms. And so antibody testing is available. That's something that's being offered. However, given the very, very low incidence that we've had in our community, we're not seeing really any positives off of that yet. And we can anticipate that that number will rise, but because we started at an extremely low number to begin with, the positivity of that is also going to be very low.
Right. And in that study, even though we said the antibody testing went up 1.1 to 1.5%, so really low presence, and as Dr. Stine mentioned, and globally for Good Samaritan, the only positive antibody results we've had is someone that had antibody testing that also we tested positive for coronavirus. So we knew they had coronavirus, and it was just a matter of had it been long enough that they developed antibodies. We haven't had any that have had a previous infection that then we've said have had antibodies. On the testing front, just to communicate, the Optum Indiana State Department of Health testing sites. So there was an Optum site set up at the National Guard Armory. They moved that to the VU Green Auditorium to increase access. Optum has now worked with the state and has closed a number of sites that were low volume. They just weren't getting a lot of appointments. The Knox County site is one of the sites that was closed. So the state-funded, state-sponsored testing is in Princeton and in Terre Haute are the two closest state-sponsored testing sites. So what does state-sponsored means? That means that it is free testing. You go online, get an appointment, and can have free testing. At our Good Samaritan Convenient Care and through your physician office, testing can be ordered through Good Samaritan, and that goes through the normal means of your insurance and payer processes. But just to clarify that, because there were some questions.
So moving forward, a lot of people will be asking, so 4th of July holiday is coming up, obviously, and there was some issues a few weeks back as to whether to conduct any type of celebration here locally or not, and that's basically been squelched for right now, and I think given what we're seeing, that's not necessarily a bad idea. Right. That being said, there's still going to be plenty of celebrations going on around here locally. And so we want to make sure and emphasize to everybody that as you do your family gatherings and get together for celebration of our country's independence, it's important to realize that all the things that we've discussed all along are still very important. A lot of outdoor type celebrations probably going to be conducted, and probably better than packing us all into smaller locations, so that's important. Hand hygiene, masking, all those things still very important. I get a lot of questions about hand sanitizer versus hand washing versus pouring bleach all over your whole body. And I think it's important to realize that anything is reducing the spread of the virus as far as hand hygiene is concerned. So it's not essential that you have hand sanitizer. It's just that you're conducting that in a manner, whether you're washing your hands for 30 seconds or whether you are using hand sanitizer, all of those things are reducing that spread. So it's really just important to keep those things in mind. And as we discussed early on, as far as touching your face, touching your mucous membranes, all of these things still continue to be an important factor.
Yeah. And that's a very key point. So there are going to be times as you are out that you're going to touch a number of items, and even though we know hard surface contamination has been viewed as CDC as less likely, and it's more the droplets from individual to individual, thus the masking. If you don't have hand hygiene, don't have an opportunity to wash your hands, you cannot get coronavirus that's going to absorb through your hands. Just keep them off your face until you get a chance to clean up. And that keeps you protected. I think as we look at that, it's about creating that habit and being just thoughtful of that, and it takes a while. I'm pretty sure the first few times that we shot this, I was touching my face right before we went live and having to be made aware of that, and now after sitting on my hands for a couple months, I've gotten the habit down of don't touch my face.
And it's important also to realize that to help educate our children in this as well. And ironically, when we started this, our children were probably better at coughing into their elbows and sleeves than what the majority of us adults were. But it's important to continue that. And the thing that we are seeing, interestingly, in our primary care offices is less spread of all of the other usual viral infections that we see throughout the year because of what we're doing to prevent COVID-19, which is quite fascinating and actually what we would expect. But we anticipate that to be the case as we roll into the summer and then into the fall months.
Sure. So. Typical infection prevention really got put at the forefront due to coronavirus. All of these steps that we've talked about have been the way to prevent transmission of illness for a long, long time. But with global pandemic, you kind of reprioritize.
Yes, well, it's somewhat interesting. In my wife and her dental office, when this all hit, they did nothing different because in their world, the universal precautions are so important because of aerosolized materials, things like that. So there's been very little change for some people that, just like in the hospital here, universal precautions is universal precautions. Timothy, any particular things coming in as far as questions from the public?
So someone asked about the new cases. Are they clusters from businesses, churches, or family gatherings, or are they just like, random individuals? Do we know that information?
Kind of a combination. So we have had a few of the incidents that have had what's called primary contact. So one case was in contact with another, and I guess you could consider that a cluster. We've also had some one here, that really didn't have any spread attached to it. Now, exactly where that first case started, that's really difficult in figuring out from an epidemiology standpoint where that patient zero of a cluster, if you want to call it that, started. But we've had a little bit of both, and that's why today mentioning the gatherings and focusing on social distancing and masking. So masks are uncomfortable. If you don't wear them all the time, you don't like them. But if there's one thing that you can leave this with is that with 45% of patients being asymptomatic and not knowing the details around the spread of that yet, masking is really important for being around individuals. So if you're within 6 feet for more than 15 minutes, that is where we really know that transmission goes up. So long answer, but a little bit of both.
Okay, and then someone kind of asked about, the hospitalized COVID patient. Do we know, can you share the severity of that illness? Or?
Yeah, we've been very fortunate that early on we had just a limited number of cases that were a little more ill, that were hospitalized, but really hospitalized for very brief periods of time. and only just one or two patients that were in for several days. But what we've seen of late, even though the number of positive cases has gone up and risen, the number of hospitalized patients has been extremely low, really just one hospitalized patient since the holiday weekend. So we hope that tells us that the virulence of the virus continues to go down, and also it speaks a little bit to the populations that are getting infected. We know that more younger people are out, more younger people are getting infection, but our population that has been at risk has done an excellent job as far as protecting themselves, as far as all the measures that we have talked about all along, and so we hope that continues to be the case.
Yeah. And I think one of the things that folks research and hear about is ventilator usage and ICU usage, and how probably the question is a lot about, are the patients being hospitalized requiring that type of intervention? And the answer is that since Memorial Day, the one hospitalization we mentioned has not required ventilation. ICU needs has been more on a stable medical floor with care being delivered there. So obviously we can't share much more than that, but where we have seen hospitalizations, it's been on the lower acuity need than mechanical ventilation and those types of interventions.
And another person wonders, how far back from a positive test does others need to worry about contact with individual that test positive?
Sure, and when we talk about that basically relates back to what our quarantine standards have been. And there's been some variance in that in the past, going from 7 days to 10 days to 14 days and so forth. But I think the important thing to realize that we don't know right now is from the time a person gets exposed, at what point are they potentially shedding virus? Right. At what point are they no longer shedding virus? I've had some experience in my practice with a patient who had symptoms and was tested positive and went into a 14-day quarantine, and then prior to being allowed back at their workplace were required to be tested again. At past 14 days, the patient was tested and was positive still. So the unfortunate thing is we really think that patient probably is not shedding virus, but probably has the viral particles and material around that makes the test be positive. So I think it's important to realize that number one, 44 to 45% of patients who test positive are asymptomatic, so relying on symptoms is not necessarily all that helpful. I think it's important to realize that 7 to 14-day quarantine period is still kind of our standard right now, depending upon who you talk to. We've been very fortunate. Dr. Stewart's been very strict on the 14-day quarantine. I think that has paid dividends all along. So in our practice and throughout the hospital, we've been sticking with that sort of policy as well. And it's important to realize that the population that is closest with those family members or who lives in their home needs to be cognizant of what their symptoms would be or any concern of infection, and can receive testing now much easier than they did even a month or 2 months ago because of the available supplies.
Right. Just a comment on symptomatic versus asymptomatic. When you're asymptomatic, it's hard to act on. You don't know what you don't know. But what we can say is if you have symptoms, you are contagious.
Yes.
I mean, we know if you have enough of a viral load, you are showing symptoms, then you're considered contagious.
And one of the interesting things that we have observed throughout this is even in the early stages of this, where we had positive patients that were isolated at home on quarantine, that virtually none of their family members became infected with this, which I think is quite fascinating. Either they are super vigilant about their hand hygiene and quarantine at home, or those family members were never symptomatic, or the spread is just simply not as bad as what we thought in those conditions. So that's something that again, research is getting better and better as we go month by month to determine when that viral shedding is the greatest, when you are most infectious, when you're recovered, so forth. But thus far, the precautions that have been set in place have been serving us well.
And kind of talking about how long the virus lives. Someone said the CDC said the virus has mutated so it can live longer. Do you see this causing a second round of the epidemic being worse?
I don't necessarily see that as a second round, because as we've talked about, I think what we're going to see is a continuation of a low level of infection that will go on for literally months and months. The good news has been that the surface transmission, things like that, research has indicated that that's not nearly as much of a problem as it was, and that masking has been beneficial, and that we have seen that when that's instituted, the transmission rates drop significantly. So the measures that have been taken have been helpful. So the hope is that the mutation of the virus, as it continues on, becomes less and less virulent, and we're seeing that in our statistics so far.
Okay, now, another, on the topic of visitation, someone asked again about the OB floor.
Mm-hmm.
So what are we looking at as far as visitation goes in the future?
So we met last week, the team that's been discussing visitation, and we will be rolling out new updated visitation guidelines after the 4th of July. Right now we're at one visitor, really across the organization. So medical office, surgery, inpatient can have one visitor. We will be moving that to 2 visitors. There will still be the check-in points to make sure that everybody is masking. Visitors will have to go through a screening from now until July 6th, and then looking at what that screening will look like going forward. Patients that are coming in for ambulatory types of visits, of course, are screened upon admission for any symptoms, and then decisions made on the care there. But after the 4th of July, we will be relaxing that further to the 2 visitors per area, whether that's medical office, ER, inpatient, trying to be consistent across those areas.
I think one of the most important things that you can do to support the family that is having a delivery is ahead of time pick those 2 family members. Figure out who's going to be in the room with you. I practiced OB for 20 years, and the family sitting vigil out in the waiting area is of no benefit to the mother or the family anyway. Go clean their house, go do their laundry, go prepare some meals for them, but let the 2 close family members that are going to be with them in the labor and delivery room do their job. And when the baby comes, announcements will come, and fortunately we've had good luck with that so far, and we'll continue to expand as we can, as safely as we can.
One thing to add on the visitation, kind of unrelated to the patient visitation, is we do have, and historically, we'll say pre-COVID, have a number of community members that come to the hospital for the gift shop, for the cafeteria, for non-visiting a patient reasons. We are still restricting that. If we do have visitors in for seeing a patient and they would like to go to the cafeteria, go to the gift shop, there's precautions in place for that, but coming just for those reasons is something that we're still trying to restrict. And that also goes for, we have a number of community meetings that were happening at the hospital. We also have outside vendors and external folks that come to the hospital, and we're being restrictive of that as well, unless there's some business necessity or healthcare need that they're partnering with Good Samaritan on. So still restricting a lot of the traffic in the organization, and that will continue for the foreseeable future.
Yeah, someone asked, how does one do the antibody testing? So can you go through like how you get that test, maybe even how it's performed?
Sure. So one of the most important things is to discuss it with a provider because it's important to know why you want that test done. We have a number of tests that are done for legitimate clinical reasons, and then we have some tests that are done because it's required by a workplace to return back to work. So I think the important first conversation is to meet with your care provider and discuss why you want to have that test done. Because as we've talked about all along, the testing doesn't change anything, whether it is the initial antigen testing, which is a nasal swab procedure where a cotton swab is inserted into the posterior pharynx and in the posterior nasopharynx, versus the antibody test, which is a blood test that is performed. And one of the interesting things that we've been faced with lately is people are choosing to come and get antibody testing done because it's a blood test rather than the horrible nasal swab that other people have had to have done. So first of all, the nasal swabbing is very important to be done properly. We've had a lot of efforts at making sure that people have been trained to do that properly in our facility, and then we've also offered that service to other places to make sure that they're doing it properly. So the nasal swabbing, although it sounds terrible, it's not as bad as it might seem, but that is how we do the antigen testing to test if you actually have the active disease at this time, and then the antibody testing is a blood draw. And so you need an order from a physician or a provider to have that done. But the first thing that needs to happen is to have a conversation about that, because people may not fully understand that if they get an antibody test, what the implications of that antibody test are. And again, when we were speaking about the patient that came to me asking that they had to have the test done and return to work, unfortunately, that didn't really help them in any way. A conversation about how long they had had the infection, how long they quarantined, would have been much more valuable than them showing up with their second test and saying, hey, I have a second test and now I can't go back to work, and what do we do from here? So having that conversation with a provider is an important first step.
Okay, so I'm going to ask about masking. She says she's at high risk and shops only early in the morning for the at-risk hours and sees a lot of people without masks on. So if masks help stop the spread, why is the state not requiring everybody to wear a mask?
Yeah, I think it comes down to some of that Fairbanks study and what we're seeing on a statewide basis with the number of cases have decreased statewide, even though we've seen a little bit of a local increase. So masking is recommended. There are businesses that are requiring masking, and if you enter one of those businesses, you need to respect that and follow their rules as far as masking. I know I've seen some reports on more of a national landscape where some areas that have required masking have had issues with patrons coming in and not following the rules. It's very simple. If you're entering a business, you follow their rules. As far as the masking, it's not mandated by the state. Certainly our recommendation would be if you're in that high-risk population. I think what I heard was really well. So I had a plan to go early, decrease traffic, wear a mask, keep your distance from folks, and if you see somebody you know and stop and talk to them and they don't have a mask on, you can talk from 7 foot just as easily as you can 3. So just kind of keep your space and handle it that way. As we see more increased transmission, there may be more community discussion of mandatory masking that some of the larger metropolitan areas have seen. But when it goes back to active disease in the state and transmission, we just haven't seen the numbers that have necessitated any type of executive order or anything along those lines that require masking. Certainly we do here at Good Samaritan because of the healthcare emphasis.
But that's why we see such a discrepancy and why the news reporting is very different in New York State and in New York City and in California than it is here, and it's simply because of that very low incidence of disease that we have in our community. So we applaud everybody for taking those precautions and respecting that, but realize that every step that has been taken, limiting the number of patrons that go to a facility or to a restaurant or to a retail facility, that's a step in reducing that. The traffic flow patterns that we see within our grocery vendors, all of those things are precautions that are trying to help with that as well. So realize that it's not just all about masking, it's the compendium of all that.
Yeah. Walmart, JC, from a grocery standpoint, have the ability to schedule pickup, and so you can have it brought to your vehicle, which is a good avenue. And then should also mention that I think the masking, non-masking has been a kind of a polarizing discussion. There are individuals with chronic obstructive pulmonary disease or other lung illness that wearing a mask could be detrimental to their breathing. And so there are folks that don't wear a mask because it could cause an exacerbation of health issues. So don't just look at it as so-and-so's not wearing a mask and they are reckless. There may be a reason.
Okay, couple more questions. So what is usually the first symptom reported?
Sure. The first symptom reported, probably the most important one, would be no symptoms, and that is that you may not have any symptoms at all. Many people, however, still report respiratory symptoms. So we talk about this in terms of a typical viral upper respiratory infection with nasal congestion, cough, runny nose, and then potentially a fever. However, we have seen at least 1 or 2 demonstrated cases of gastrointestinal symptoms, which would be diarrhea, abdominal bloating, cramping, abdominal pain, those types of things. The thing to keep in mind, though, is that with the majority of upper respiratory infections, viral illnesses last just for a very few limited number of days. This illness seems to last for a longer period of time. Same thing with gastrointestinal type illnesses that are viral. Those usually for most people last 12, 24, 36 hours and then are gone. The symptoms that are associated with COVID-19 typically last a bit longer than that. So really it's symptoms and then prolonged illness. And with anything, we ask everyone to report on symptoms that haven't resolved within a day or 2. It's not just that you would have fever, it's not just that you would have runny nose or cough or congestion, because this time of year the predominant cause of that by far are nasal sinus allergies.
Right.
That is the most common thing that we are seeing right now, is basically patients coming in with terrible nasal sinus allergies. However, those patients rarely, if ever, have any type of fever, and they typically have a pattern of this in years past. So again, a clinical evaluation will help us to differentiate that from what would be concerning for coronavirus.
Okay, and last question I have for you. Does the hospital still need homemade masks?
Yes. Yes. As we continue to move forward, masks are one of those personal protective equipment supplies that we keep a very close eye on. And what we know with the homemade mask is that keeps the droplets in while they're not medical grade. Certainly for our visitors coming in, for patients coming in for ambulatory types of services, and then when we hand those out, they can use them in the community, or we're going to launder those. But long answer, but yes, we would still like to have those masks, and we can put something up on social media as far as a post as to who to contact, as to where to get those masks and where we inventory those.
Yeah. I would say from a social media standpoint, if you guys would like to open up a best masks, worst masks type of send-in thing, I think that would be fantastic. Engineering over there, maybe Clint. Not just in terms of how they're made or how they're worn, but kind of a compendium of comparisons. Maybe you guys can put that up in the next few weeks. Challenge. All right. Hey, thank you all very much for joining us. We'll again be with you in about a week or so. And please continue, if you have any other questions, submit online, and we'll try to get those throughout the day.
Thank you.